Welcome back to 843 TV. We are at the Hilton Head campus of the St. Joseph Candler Research Center, and talking with us now is Dr. John Mikell, and you are a radiation oncologist, and you've been around this area for quite some time, kind of a local boy, so share with us a little bit about your background.
Yes, ma'am. I'm from Savannah originally, and I'm very grateful to have the opportunity to move home and continue to help folks here in my community. I went to school originally in Savannah during lower, middle, and high school, and then went to college up in Virginia. Came closer to home and went to Medical College of Georgia for my medical school, and then did my residency training at Emory University in Atlanta. And after I finished that up in 2015, moved back here to the Low Country, and it's been a great experience thus far.
And it's changed a lot since you were a kid, right?
Lord, yes ma'am, it has, especially over here in the Bluffton Hilton Head area.
It's amazing, isn't it?
Yeah, just the amount of growth is really spectacular to see. It's certainly a much larger community that we have to serve over here than existed, gosh, even 10 years ago.
Absolutely.
Well, and here we have the Lewis Cancer and Research Pavilion adding to that expansion, which is really exciting. You know, that it's going to be a wonderful growth addition to that community. I'm curious, you know, within the world of oncology, we've seen a lot of new technology. Tell us a little bit about what you've been working with, what your experience has been with it.
Yes, ma'am. Well, we are very fortunate these days to live in an area where so much work is being put into the technology that goes into these treatments. Modern radiation therapy is really a marvel. These days with modern equipment, we're really able to sculpt a dose of radiation in 3 dimensions to tightly conform to an area that we want to treat, a tumor or a region that needs treatment. What that serves to do is basically make sure that we're hitting the area that we want to hit and reducing the amount of radiation that goes to normal healthy tissue surrounding the area that we want to treat. All of this helps to reduce side effects of treatment and increase our chances of having a good outcome from the treatment.
Absolutely. So in layman's terms, you're pinpointing and targeting that area so much more directly than in the past with this new technology. Exactly.
And with modern equipment, we're very fortunate here in the Hilton Head campus and in Savannah to have technology called TrueBeam, which is the latest and greatest linear accelerator, which is our clinical radiation machine. The TrueBeam linear accelerator combines the ability not just to deliver focused radiation treatment, but also to provide imaging each day before treatment, which allows us to ensure that we are treating exactly the area that we want to be treating each day. Again, this combination of being able to focus the treatment very precisely on the area where we want to do the treatment and also ensure that we are in fact hitting the area that we want to hit each day helps to provide that, helps to improve that twofold goal of both reducing side effects of treatment and improving efficacy of the treatment.
I would imagine that that's really important in things like esophageal cancer, or things where you can really damage, excuse me, where that surrounding tissue being damaged plays a huge role in the quality of life.
Absolutely. For so many cancers, outcomes from the treatment are improving these days. So when patients are cured from these cancers, we want them to have as little memory of what happened during their treatment as possible. And as part of that, we want to do everything that we can do to reduce side effects. So yes, ma'am, for many cancers such as esophageal cancer, prostate cancer, breast cancer, and basically all the cancers we treat, we're focused on improving outcomes while also reducing the long-term burden of the treatments. When we're trying to cure you from this, we don't want you to be worried about side effects years down the line. We want to leave the smallest possible footprint from these treatments.
So I have to say I'm a little bit of a gizmo girl, and I couldn't help overhearing you were chatting before we started about a type of knife that you have in Savannah, something that sounded really cool to me.
Yes, ma'am. I was talking about CyberKnife, which isn't actually a knife per se.
Sounds like a James from a James Bond movie.
No,
yes, ma'am.
Terminator all the way.
It's a fantastic piece of equipment we have over in our Savannah office. What CyberKnife allows us to do is provide very focused pinpoint doses of radiation in a small area. And that's combined with the ability to actually track a target during the actual treatment, which provides an added layer of precision. We use CyberKnife for various different tumors, brain tumors that are very small, for lung cancers that are small and might be moving. CyberKnife allows us to deliver painless, very precision-focused treatment and sometimes just 1 to 5 treatments on a small little tumor. For prostate cancer, for example, not every patient's a candidate, but for some patients with earlier stage prostate cancer, we're able to deliver a full course of radiation treatment in only 5 treatments, which is a remarkable advancement over traditional treatments. A traditional course of radiation is often delivered for prostate cancer, for example, over 8 to 9 weeks of daily treatment, Monday through Friday. And with CyberKnife, we're able to shorten that to just 5 treatments.
Wow.
The treatments are quick. They take about 30 to 45 minutes. Patient lies on the table and listens to whatever music they want to listen to. The machine moves around them and delivers all these tiny beams of radiation that all converge there on the prostate. And that's what allows us to deliver this high-dose focused radiation there on the prostate, while at the same time sparing the healthy tissues surrounding the prostate.
Wow. This is really interesting to hear and educational and almost comforting if someone has to deal with this, that you've got an easier way, a better solution. Do you sit down with the patients and kind of map out this journey for them with the CyberKnife or whatever the technologies you're going to be using?
Yes, ma'am, absolutely. There are almost invariably several different options as far as treatment paths that we can pursue with each patient. Mm-hmm. So a lot of my job is going through these options with patients and really picking in partnership with the patient what's going to be best for them. We have multiple different schedules as far as how radiation can be delivered, multiple different techniques that the treatment can be applied, and all of these things can be customized according to how a patient would like to be treated and what their individual goals are for treatment.
So this all sounds wonderful. I'm certainly of a generation, as I'm sure many of our viewers are, where we have that old frame of reference, and I think that's what gets so scary about cancer, you know, how sick you get, what the side effects are like, not a very high chance of recovery. Can you give us a little picture of traditional side effects to current and traditional cure rate to current? Sure.
Well, in the old days, for certain cancers, your only option was a large surgery, and if they couldn't cut it all out, then your long-term prospects were dim. But these days, cancer treatment has become much more of an integrated approach, where we're using not just surgery, not just chemotherapy, not just radiation, but often multiple tools for the same patient, so that we can reduce the burden of treatment while still maintaining the same outcomes. In the example of breast cancer, for example, in the old days, if you had an early stage breast cancer, your only choice was mastectomy, basically to have the whole breast removed. These days, we often go down the route of breast conservation, wherein a woman is able to keep her breast. We remove the lump of visible tumor through surgery, and then radiation is done to the rest of the breast to help basically give the same chance of cure that you would had you had the whole breast removed. And so by combining treatments, we can improve outcomes while reducing the burden of the actual treatment. And at the same time, for many of these early stage cancers, we're able to achieve outstanding rates of cure. So much so that really the focus for many of these disease sites has shifted from increasing the efficacy of the treatment to then focusing more on the convenience of the treatment, the tolerability of the treatment, reducing the burden of the treatment. For breast cancer, for example, a traditional course of radiation for breast cancer was somewhere in the range of 5 to 6 weeks of daily treatment. That has now been shortened to sometimes just 3 or 4 weeks, while similarly maintaining the same chances of cure and often reducing the overall burden of the treatment in terms of side effects and inconvenience to the patient.
And quickly, as we wrap up, all these new technologies we've talked about will be available at the new campus?
Yes, ma'am. We're very excited for what's going to be available on our Bluffton campus when that opens in about a year. TrueBeam will have a linear accelerator there, bring the finest technology right there in the Bluffton area and reduce travel time for many of our local patients. We'll have many imaging techniques there that we'll be able to do, and yes, ma'am, all this will be right there in Bluffton, convenient for patients.
That's really exciting. Well, Dr. Mikell, thank you so much for joining us.
Thank you so much for having me.
This has been incredibly informative and very uplifting, actually.
Yes.
And thank you for joining us as well for another episode of 843 TV,
where communities come to speak.